So thank you again for having me. The first part here will be talking about imaging basics in retina. And so my name is Sarah Reed, and these images are taken from patients cared for at Retina Consultants of Hawaii by either me or one of my three partners, Greg Kokame, Jim Lai, and Ray Wee. So we're going to be talking today about multimodal imaging, including color fundus photos, fundus autofluorescence, fluorescein angiography, and ICG angiography. I find fundus photography to be especially helpful in a number of instances when taking care of patients, and it's helpful to kind of have an organized way of looking at the photos, focusing on the vitreous, the disc, the vessels, macula, and the periphery. Often I'll use it as a baseline imaging for future comparison. This is an example of a choroidal osteoma. This patient eventually developed choroidal neovascular membranes, and so it was helpful to follow the growth of the osteoma as well as complications from the CNVM. It can also be useful to document fine details, especially in the periphery. This is a diffuse choroidal melanoma. Here you can see the feathery borders of the lesion, as well as the subretinal fluid. One of the nice things about the Zeiss True Color is that you can pick up subtle pigmentary changes. This is an example of oculodermal melanocytosis, and you can see here the increased pigmentation in the left eye compared to the right. And this is also seen in the iris heterochromia, as well as the scleral discoloration. Specifically, when looking over time, it can be especially helpful not only clinically, but also to educate the patient as to how treatment is going. This is a patient with intraocular lymphoma that was treated with local therapy with intravitreal methotrexate. You can see resolution of the subretinal lesions. Often in clinic, I'll be discussing surgical options with patients, and fundus photography, especially peripherally, can be helpful in talking about rhegmatogenous detachments and optional tractional detachments, as well as using laser barricade for subclinical detachments. So in this last photo here on the right, you can see that laser barricade was used here, and this can also be helpful to follow the patient over time to ensure that there's no progression of the detachment past the laser. This is a pediatric retinal detachment treated with a primary scleral buckle, and so here I can show the patient that the fluid has resolved and that she's doing well. Preoperative documentation can also be helpful for medical legal reasons. This is a chronic RD that was referred to me, and then on exam, I found that the patient had an intraocular foreign body. I often will use fundus autofluorescence as an adjunct to conventional fundus photography. Autofluorescence relies on the intrinsic fluorescence emitted by ocular tissue after stimulation by an excitation energy. And there's a natural autofluorescence to a number of tissues in the eye, including the corneal epithelium and endothelium, the lens, optic nerve head drusen, as well as macula and RPE pigment. In the retina, the lipofuscin within the photoreceptors causes autofluorescence, and this is due to the A2E component. The lipofuscin accumulates within the RPE during outer segment phagocytosis as part of the visual cycle. And so autofluorescence can be used as a surrogate for health of the RPE, and so we'll see hypoautofluorescence with severe RPE atrophy. And so this is a case of Sorsby's fundus dystrophy confirmed by genetic testing positive for TIMP3. And here we can see the autofluorescence really shows us the areas of RPE loss, and this can be helpful to follow progression over time. In some diseases, increased autofluorescence can be a marker for disease activity. This is an example of persistent placoid maculopathy, which is on the spectrum of serpiginous and AMPI. And autofluorescence can be used to properly mark the borders of the lesion, but also increased autofluorescence at the lesion borders can indicate increased activity of the disease and can help to guide immunosuppression. This is a patient referred for atypical optic nerve appearance, and here on autofluorescence you can see the clear optic nerve head drusen. Peripheral pathology, especially drusen, can often be visualized well with fundus autofluorescence. This is an example of a young patient who had glomerulonephritis, and so this is glomerulopathy-associated drusen, which is a relatively rare disease, but you can see here the striking visualization of the drusen on autofluorescence. More commonly in my clinic, vitelliform lesions can occur both in this case, which is a adult onset foveal pigment epithelial dystrophy, which is a form of inherited pattern dystrophy, but also as a complication of reticular and cuticular drusen. And then in this case, subretinal deposits accumulate due to RPE dysfunction. It's important to differentiate this from choroidal neovascular membranes. So usually these patients have a relatively good visual prognosis, and most importantly, these lesions don't respond to anti-VEGF therapy.